Hello, hello, Dr. Bhaskar, can you hear me? Hello, 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 Dr. Bhaskar, can you hear me? Can you hear me? Hello, hello, can you hear me, Bhaskar? Can you hear me?
Yes, I can hear you. Sorry, I was on mute.
Can you hear me, Bhaskar?
Yes, I can hear you.
Oh, okay. So we'll be starting the session in 5 minutes.
Mhm.
Yeah.
Good evening, one and all. Introducing myself, I am Tanuja from E2, Department of EEE, RGUKT Nojpur. My warm welcome to the dignitaries present over here, invited guests, and my dear friends. Let me briefly convey the reason for our gathering today. That is, to inaugurate the Student Seminar Series program, which is going to be started first time here in the RGUKT Nojpur, initiated by the Department of Electrical and Electronics Engineering. The main motto of this program is to make up the minds of the students with the knowledge in engineering and technical streams. I hope this seminar series is going to be very successful with the cooperation of both teachers and the students. Without any delay, let us start our program with a prayer song. गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलत्वायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यकलाक्षेत्रे गुरुधर्मसदाराध्याय गुरुपुत्र परितात्रे गुरुपाखण्डकण्डकाय गीतसाराय गीततत्त्वाय गीतकोत्राय धीमहि गूढगुल्फाय घण्टमत्ताय गोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि. Thank you, friends, for the devotional start. Now I request our respective head of the department, J. Chakravarti sir, for further proceedings.
Thank you. Good evening, everyone. But today's chief guest and honorable director, sir, Professor G.V.R. Srinivas Rao garu, and our guest of honor, Professor G. Mohan Rao garu, and our speaker, Dr. Bhaskar Chintada garu, and our faculties and students. Good evening to everyone. So first, I welcome everyone to this inaugural session of student seminar series. So I'll briefly explain what exactly this student seminar series, and then we'll proceed to the next program. So the student seminar series, in short, AAAS, it is basically initiated by the Department of Electrical and Electronics Engineering at RGKT Nosweed. The main motto of this AAAS is to introduce and to interact with world-class researchers through the seminars. So particularly, what we plan is to accommodate the seminars by the student community only. Student community such as starting with bachelor's, master's, doctorates, and postdoctoral level uh, from world-class universities only. So that is our main motto of initiating this AAAS. So the mainly what we are planning here is to made a structure of this AAAS will consist of 2 student coordinators from EEE basically at initial level, and a faculty advisor too. So so we are planning for each seminar duration of 1 hour. Initially, we are planning for these seminars for a frequency of about every seminar for every 2 weeks. Every 2 weeks. So this is in short about AAAS. And now I request our chief guest and honorable director sir to uh, deliver his message regarding this seminar series. Over to you, sir.
The president of this inaugural function, Mr. Chakravarti, head of the department of EEE. The guest of honor, Professor Mohan Rao Garu, the advisor R&D to RGKT, the administrative officer, Pradeep Kumar, Mr. Shravani, the Dean of Academic Affairs, heads of the departments of Electronics and Communication, Mechanical Engineering, the faculty members of EC and EEE, my dear student friends, and on behalf of RGKT Nosweed, I extend a warm welcome to the inaugural session speaker, Dr. B.R. Chintada. I'm very happy to be associated with this program, and I take this opportunity to initially congratulate the EEE department and especially head of the department. Right from himself taking charge as HOD, he started this type of programs. Almost every fortnight, the EEE department is conducting one or other seminar and inculcating the research ideas, infusing the research ideas into the budding engineers, the minds of the budding engineers. And this particular program, a student seminar series, with a vision of introducing the research component in addition to the regular curriculum to the students, that is highly laudable. And the topic taken up for today's session, that is on advanced ultrasound imaging biomarkers, is very interesting to me. Why? Because basically I'm a civil engineer specialized in environmental engineering, and we are now very much worried about the environmental contamination throughout the not only the world, entire the universe. How to monitor all the effects of this environmental contamination, where this particular biomarkers will be highly useful. They give us, as specifically mentioned by the head of the Department of Electrical Engineering, the early warning signals before irreversible damage occurs. Exactly. And my dear student friends, biomarker is nothing but it's a characteristic which is an indicator of a biological activity, and it can help with evaluating and preventive measures, and it can help monitoring the possible effects of this various fields, including this environmental degradation the world is facing now. So I once again congratulate the student body and the faculty in charges who are monitoring this particular activity, for selecting a very nice topic for the inaugural session. And I'm very happy to to introduce the audience that the keynote speaker or the inaugural session speaker is none other than an alumni of this particular institute. It's very interesting. So I welcome you, sir, Mr. B.R. Sintadam.
Thank you, sir.
Right. So with this brief remarks, I thank once again the organizers for giving me a nice opportunity to be with you on this nice evening. Thank you very much.
Now I would like to request our guest of honor, Professor G. Mohan Rao Garu, to say a few words about seminar series and its importance.
Director of RGUKT, Nujuvidu, Professor Srinivas Rao Garu, Head of the Department of Electrical and Electronics Engineering, Mr. Chakravarti, other colleagues and student friends. I felt very happy when Mr. Chakravarti came and said that he is organizing this student seminars, because when I teach a course, I make it a point that every student who takes the course has to give a seminar, and that will be one midterm test. So no matter how many students are there, we will plan. Now, the basic idea of a student seminar is that the student will get an opportunity to make a presentation of what he is doing. The number two is that while giving the seminars, he will get exposed to a audience who ask questions. So this will help in future endeavors. So the idea of this student seminar series taken by Electrical Engineering Department is appreciated, and I ask our student friends of RGUKT to get exposed to what is going on around us in research. Apart from that, they should also try to learn the tricks of making a good seminar, which will not be taught anywhere. So this has to be learned only by yourselves. So this comes only with the practice, and if you attend as many seminars as possible, then you know how to make a good seminar. So I wish this program all the success, and I hope Mr. Chakravarti will get more and more speakers, because getting speakers is also not that easy. So we'll also try to help with known people, and I wish all the best. Thank you.
Now I would like to request our head of the department for EC, Shyam sir, to introduce our inaugural speaker.
Good evening, first of all, good evening to all the distinguished members, my dear colleagues, students, and a very good evening to our alumni also, Bhaskar Rao. So first of all, when Chakravarti sir, the head of the department Tripoli, has brought this so to our notice, we felt very happy with the vision and the aim of this particular seminar series. And I'm quite honored to be a part of the first part of the inaugural session of this event. by looking into the vision, which is to bring and introduce world-class research to the RGUKT. So I feel that the bringing the research to the undergraduate program is very much essential, which is happening across the world-class institutions. So, and also I felt happy as the first speaker of this particular inaugural series is from the Department of ECE. Now I'd like to give a small introduction regarding our alumni, the Bhaskar Rao. So Dr. Bhaskar Rao received the BTech degree in ECE department from 2014 batch, and later he pursued his MS program at IIT Madras. And from there he moved to a PhD in ETH Switzerland, and he completed it in 2021. And currently now he is doing his postdoctoral research fellowship at USA in Boston University. And also now, so the topic as it is on so advanced ultrasound imaging biomarkers. Now I request the Bhaskar student so to talk to give us the view on this particular topic. Thank you for the HOD Triple Department for giving this opportunity to be a part of this inaugural event.
Now I would like to request our inaugural speaker to say a few words about seminar series.
Hello.
Over to you, Bhaskar.
Sorry, it's morning here. I have morning face, so sorry for that. So after Chakravarti sir contacted me on LinkedIn for the student seminar series, so there is always a desire for me to contribute towards something to the RGUKT community. I felt like it's a right theme to start with. So during my days at RGUKT, I felt like we lacked the exposure to other academic events like seminar series and stuff like that. The main motivation about any seminar series is the stimulus, the exposure you get by listening to seminar series have a very great impact on our minds. I remember we had a few seminars during my days at RGUKT. I didn't understand completely what they are talking about, but I understand the applications and the basic principles they're using it. So that provoked my mind and stimulated my mind. I think these kind of seminar series does that job. And I thank student body and HOD and director and other governing council of RGUKT who are involved in this organizing this event. Thank you very much.
Now, I would like to request Dr. Jyoti Naik from Faculty of Electrical Engineering Department just to give the vote of thanks to this inaugural session, and then we'll after that we'll move on to the seminar.
Good evening, all. First of all, I thank for the Chief Guest, Professor G.V.R. Srinivasa, Director of RGUKT Management, for giving the permission to go with this proposed place, and also for joining in this inaugural session and giving his view how to make the success of that place. And thank to Professor G. Mohan Rao Garu, who is presented here as a guest of honor in today's inaugural session and sharing his view and wishing success for the proposed place. And thank to head of the department for adding these kind of new things to the department and encouraging to go with the proposed place. And also thank to head of the ECE for introducing the inaugural session speaker. And thank to the Dean of RGUKT University for attending the inaugural session, and also other head of the departments and the faculty members. And special thanks to the today's inaugural session speaker, Dr. Bhaskar Rao Garu, for accepting our invitation and attending as the first speaker for this series. And also thank to the faculty of the Triple department for supporting to make this particular program in a smooth way. Last but not least, thank to all the students for joining the session, and I hope that we will continue till the end of the technical session. Thank you all. With this, we will close the inaugural session. Thank you all, and the technical session will be continued.
Now, I request the speaker to start his seminar. Over to you, Dr. Bhaskar.
Thank you.
So, Dr. Bhaskar, small information. So now in front of you, we have around 25 people from RGKT administration. And in the Google Meet, you can see the number is 96. We have reached the maximum limit of the Google Meet, but we are giving the live stream. So assuming that the whole RGKT news video is watching you on YouTube.
Thank
This
you.
is for
Thank
your
you
information.
for the
Yeah.
information. So can you see my screen? I'm not sure what I'm showing it to you.
No, not yet. See how to share.
Okay.
So I think you need to maximize that.
Sorry. So can you see it now?
We can able to see. Yeah, it's fine now.
Okay. Right. Thank you all for coming to my seminar talk entitled Advanced Ultrasound Biomarkers. Before I begin, I would like to thank student seminar series coordinators, head of the EEE department, Chakravarti, for messaging me on LinkedIn and inviting me. And I would also like to thank director of RGKT News Video and Dean and head of the R&D cell for the very nice introduction and for organizing this event. I would also like to thank the chair for moderating this session. Without further ado, let's start with information on my academic background. So, as you all know, I am an alumnus of RGKT. I received my BTech degree in Electronics and Communication Engineering in 2014. Later, I got my MS by research degree at Biomedical Engineering from IIT Madras in 2016. After that, I migrated to Switzerland for my doctoral studies and obtained my PhD in Information Technology and Electrical Engineering from ETH Zurich in 2021. After my PhD, again, I relocated to Boston, USA for my postdoctoral training at Massachusetts General Hospital and Harvard University. In the next slide, I'm going to talk about my academic life at RGKT briefly so that all the students will get better insights of what I did during my bachelor's at RGKT and kind of relate to yourself. So GPA often discussed. GPA tells how successful you have been at the college academics. So here is my semester-wise GPA chart. X-axis, Y-axis are self-explanatory. Y-axis is GPA and X-axis is corresponding semester. So I fell from 9 point something to almost 8 in the second semester of engineering, second year, due to my unwavering support to India team for 2011 World Cup campaign. But jokes apart, but I realized that I could get GPA 8 just listening to lectures and sitting for exams. So what I did is I used the other remaining time to know more about different career paths. Then thanks to Idea Airtel 3G internet services, I could able to access the whole internet to know about different career paths. This information made me get into Indian Academy of Sciences Summer Research Fellowship in 2013 at NARL Tirupati. It's a ISRO research center. So I had a 2 months internship there. During those 2 months, I had an excellent exposure to research environment, and which helped me fine tune my career path. If I retrospect my academic life at RGUKT in Nujvidu, what I did to compensate the lost GPA is also played a key role in shaping my career path. So that is the message, subtle message I want to give for the students. So without further ado, let's start with understanding basics of ultrasound imaging. Ultrasound imaging is a prominent medical imaging modality that is safe and affordable. Affordable in the sense cheaper. B-mode imaging is synchronously used for ultrasound imaging. Each pixel of it represents the normalized amplitude received echoes. It's successfully used for visualization of different anatomical structures like liver, aorta, vertebra, like that. However, many tumors may or may not possess echogenic characteristics that would make them clearly detectable by conventional B-mode ultrasound imaging, which led to development of other imaging modalities. For example, ultrasound elastography is one of it. The need for the elastography methods is emerged from the importance of mechanical characterization of the soft tissues. Changes in mechanical attributes of tissue are generally correlated with pathological changes. For example, many cancerous lesions appear much stiffer than the benign lesions. This has been the rationale behind conventional palpation-based breast examination, liver and lean muscles examinations, where medical practitioners use their hands to detect abnormalities by feeling the stiffness of lesions. However, palpation suffers from many limitations. First, it's very subjective, meaning it depends upon the practitioner you visit. Second, it's very difficult to detect small lesions that are deep in the body from the skin. One may think that conventional ultrasound imaging that I showed you before can be used for detecting these lesions having different stiffness values. But the problem is, as mentioned previously, that these lesions may or may not possess echogenic characteristics that would make them clearly detectable by conventional B-mode ultrasound imaging. Hence, a need for new medical imaging modalities that can image the mechanical attributes of soft tissue gave rise to the field of ultrasound elastography. Multiple methods exist in ultrasound elastography. Here are a few of those prominent methods. Quasi-static elastography works on the principle that when a tissue medium is deformed, all the elements in the medium are subjected to resultant strain according to their stiffness values. This method provides relative stiffness information, but not the quantitative information. This approach has difficulty with organs that are not close to the skin, similar to the limitation of manual palpation. Another prominent elastography method is time harmonic elastography. In this method, an external exciter is used for inducing continuous multi-frequency vibrations, and they track to measure tissue stiffness. Another prominent method, shear wave elastography, is widely used for elastography. It is a widely elastography method, which is also used in my PhD thesis work. In this method, ultrasound own acoustic radiation force is used for generating broadband shear waves. Multiple acoustic radiation forces are created to induce shear waves with ISNR. These propagating shear waves are tracked using high frame rate multi-angle plane wave imaging. Shear wave is determined from the displacements obtained over multiple RF frames which is related to shear modulus of the soft tissue. Shear wave elastography has found use in many clinical applications, such as staging the fibrosis of liver. However, shear wave speed has its own limitations. For example, it has shown the poor specificity in the early diagnosis of non-alcoholic fatty liver disease. For the further understanding and diagnosis of pathological changes in soft tissues, additional biomechanical markers would be greatly beneficial. With this motivation, several biomarkers were introduced in the literature. Nonlinearity is one of them. The nonlinearity of soft tissues are explained with the help of shear waves, generally using acoustelasticity theory. It explains how the shear wave velocity of the soft tissues change subjected to external applied compression epsilon with the help of nonlinear coefficient A, where rho is the density and mu naught is the shear modulus at the rest state. Nonlinearity parameter can be used as additional biomarker in differentiating the tissue types, although their shear wave speed is the same at the resting state. So here you see two tissues with the same shear modulus at the rest state, but they exhibit different nonlinear characteristics with the applied compression. With this motivation, several studies were conducted to measure nonlinear elastic parameters of the soft tissues to complement shear wave speed with the assumption that soft tissues are elastic. However, soft tissues are intrinsically viscoelastic in nature. What does it mean? It means that the tissues exhibit both viscous and elastic characteristics when undergoing deformation. Viscoelastic nature of soft tissues can be fully characterized with the help of storage and loss moduli at a frequency omega. They are related to complex wave number of the viscoelastic medium, which is defined using phase velocity and the attenuation of the medium. By taking help of this formulation, we quantify nonlinear viscoelastic nature of soft tissues in this thesis work. So we use signal processing methods to obtain attenuation and phase velocity, and these methods are described very thoroughly in my publications. But I'm going to describe the importance of these parameters in this talk. So my PhD thesis aims to develop imaging methods such as additional biomarkers to complement existing ultrasound imaging modalities such as shear wave elastography and ultrasound computer tomography, and to study any potential confounding factors such as biomarkers that affect the correct estimation of conventional biomarkers such as shear wave speed. Accordingly, nonlinear tissue viscoelasticity was performed using acoustelastic attenuation of shear waves. A novel method was developed to image frequency-dependent speed of sound and ultrasound imaging. I would like to take the time I have for the rest of the talk to get into further details of these two topics. Given the acoustic relationship in the elastic medium, assuming small stress relaxation effects due to applied compression, it can be extended to viscoelastic domain. By replacing the shear storage modulus with complex shear modulus and replacing the nonlinear parameter A with viscoelastic nonlinear parameter A cap. Complex shear modulus can be measured from shear wave phase velocity and attenuation. Once we have shear storage and loss moduli, we can determine the viscoelastic nonlinear parameters A dash and A double dash. A dash can be interpreted as relative impact of applied quasi-static compression on storage moduli, while A interpreted as relative impact of applied quasi-static compression and loss moduli. To determine above parameters, we have used the following pipeline. We used a linear metastase. Linear metastase to apply incremental compression by axial in the axial direction, and the shear wave data at each compression step is collected. Shear wave phase velocity and attenuation were measured at each compression step. Using this mentioned formulation, we computed A dash and A double dash to infer viscoelastic, nonlinear viscoelastic nature of the soft tissues. Following setup was used for conducting experiments. A motor setup was used for applying incremental compression on the phantom and tissue samples. An ultrasound transducer was attached to one of its arms for acquiring shear wave data. A compression plate was used for facilitating uniaxial compression. The phantom lever samples are placed on a rigid plate. Incremental quasi-static stress was applied on the samples with the compression plate attached to the transducer. For the phantom study, we have used 4 oil and gelatin phantoms. We call them here phantom 1 to 4. We have increased the oil percentage in steps of 5% to emulate steatotic nature of the liver in the non-alcoholic fatty liver disease, while keeping the gelatin percentage constant. Here are the plots of shear wave velocity in the first row and the attenuation in the second row as a function of applied strain. And frequency for phantoms 1 to 4. To study the dispersion characteristics of phantom shear wave phase velocity and attenuation as a function of frequency when they are in the rest state are plotted. We have observed that shear wave speed and attenuation dispersion increased with increasing oil percentage. This observation is in line with the findings in the literature. In order to characterize the shear wave speed with high confidence with respect to applied compression, we averaged down the shear wave speed over the frequency range and plotted here. We followed the same procedure for the shear wave attenuation as well. We have observed that for all the phantoms, shear wave speed increased with applied compression and shear wave speed has decreased. So in the summary, when you apply compression, what's happening is the shear wave speed, which is infers the shear modulus, shows to increase. So this is important because when a practitioner, a radiologist collect data on your human body, they tend to apply much compression while collecting the data. So our work tells that if they apply much compression, the results they obtain are erroneous. So these are the frequency average plots of storage and loss moduli as a function of applied strain derived from shear wave phase velocity and attenuation measured in the previous steps for all the phantom experiments. These are subtracted from their respective values obtained at rest state to visualize relative change with the applied compression. We have observed that shear storage modulus has increased with applied strain, while loss modulus has decreased with applied strain. Using storage and loss moduli, nonlinear viscoelastic parameters A prime and A double prime are measured. We also computed the magnitude of complex nonlinear parameter A cap, which is obtained from magnitude of complex shear modulus G cap. We compared them with the nonlinear parameter A, which is obtained from shear modulus computed just considering the shear wave phase velocities. These parameters shown to be decreased with increasing oil percentage. It is shown that using this method, nonlinear viscoelastic nature of the soft tissues can be characterized. So in the summary, what we did is we have conducted a phantom study with different oil percentages, mimicking the disease progression in non-alcoholic fatty liver disease. So using this parameter as a biomarker, you can see that we can distinguish them. So here are the plots for shear wave speed and shear wave attenuation as a function of frequency. It has shown that porcine levers are highly dispersive. So similar to the observation in phantom experiments, we have observed that shear wave speed increased with the applied strain, while shear wave attenuation shown to be decreased with applied strain. From shear wave speed, shear wave attenuation, porcine levers, porcine means pig, porcine lever storage and loss moduli is obtained to estimate viscoelastic nonlinear parameters. Similar to phantom results, storage moduli increased with applied strain. However, it showed that loss moduli increased with the applied strain in contrast to phantom results. So in the phantom studies, we saw that with the compression, storage loss moduli decreased with the applied compression, but in the real tissues, it increased. That shows that the importance of ex vivo studies to understand a particular phenomenon. So results have shown that we can successfully characterize the nonlinear viscoelastic nature of the soft tissues using our method. Ultrasound computed tomography, another ultrasound imaging modality that is used for complementing B-mode imaging as ultrasound computed tomography. It images the local speed of sound and ultrasound attenuation. These local maps facilitates the differentiation of different tissue composition to help in the diagnosis. Conventional ultrasound computer tomography methods consist of similar transducer setup. The target medium is positioned in a water bath. So this is the breast. Usually position them in a water bath and you keep a circular transducer around it. So idea is that we operate the transducer in a multistatic mode, meaning you fire element once, but you receive with all the elements, and you repeat this process until you complete all the elements in the transducer. So since you know the geometry of the circular transducer, you will know the path length matrix L between each transmission and receive pair, and the time it takes for the transmitted echo to reach the receiving element. So time is simply the time ultrasound wave took from traveling from the receiving elements to the transmitting element. L is the path matrix. So by taking the help of regularization, we can reconstruct speed of sound, which is S. S here is slowness, which is the inverse of speed of sound. So we obtain slowness, and from there we take the inverse of it to obtain shear wave speed. Similarly, we can reconstruct speed of sound, attenuation of the ultrasound waves using amplitude information of echoes at the receiving elements. Naturally, it is beneficial to develop shear wave speed and ultrasound imaging to be compatible with existing ultrasound transducers. With this motivation, methods with ultrasound transducer and acoustic reflector are matched. In the reflector-based methods, the reflector is positioned at a known distance from the ultrasound transducer. Similar to conventional methods, multistatic data is acquired to get the time of flight information and amplitude information to reconstruct speed of sound and attenuation. In this method, we operate ultrasound transducer in multistatic mode, similar to the previously mentioned methods in the literature. As an example of free beamform multistatic data acquired at all the receiving channels when a transducer element is used for transmitting the ultrasound waves. So we delineate these reflected profiles using, you can use active contours methods, or we can use machine learning based segmentation methods to segment the reflected profiles corresponding to the reflector you positioned at the known distance. So we delineate these reflected profiles using the reflector delineation methods we have developed. These profiles are solved in a Fourier domain to compute the phase and amplitude spectrum. So phase values and amplitude spectrum values at a frequency for all transmission and receive channels are calibrated using reference water measurements. These values are used for constructing ultrasound phase velocity and ultrasound attenuation at frequency omega using the following inverse problem formulation. So L matrix is computed for the given ultrasound transducer and acoustic reflector configuration, and phi is obtained from the phase values, and B is the matrix of amplitude spectrum values for all transmission and receive pairs at frequency omega. The ultrasound phase velocity maps reconstructed at a different frequencies are used for computing their respective model parameters. Linear dispersion model with the intercept C0 and coefficient Cy are used for this purpose. Following are the Cy and C0 maps for a simulation example. Similarly, ultrasound attenuation maps reconstructed at different frequencies are used for computing their respective model parameters. A power law model with a coefficient alpha naught and exponent y are used for this purpose. Following are maps of y and alpha naught for a simulation. In both the cases, we have used an inverse problem formulation to reconstruct local maps of these model parameters. This method is tested on 2 ex vivo phantom experiments, again on pig liver samples. So here is the B mode of these 2 ex vivo experiments. For phantom A, this background is 10% gelatin, while inclusion is an ex vivo bovine skeletal muscle. It's a bovine skeletal muscle. Phantom B is a composition of inverse to phantom A, meaning the background is bovine tissue while the inclusion is gelatin. So here are the local maps of speed of sound and its model parameters. Local map of speed of sound at center frequency, and local map of speed of sound model parameters Cy and C0 for both the phantoms. Here are the local maps of ultrasound attenuation and its model parameters for ex vivo experiments. The local map of attenuation at center frequency, and the local map of attenuation model parameters alpha naught and y. We could see that both the reconstruction maps, speed of sound and the attenuation of phantom A or B are inverse of phantom B. So we have used the phantoms with the composition inverse to each other, and we have obtained the speed of sound and attenuation in the similar fashion. So which indicates the potential use of speed of sound and ultrasound attenuation model parameters as biomarkers. bulk storage and loss modulus also can be determined using the frequency dependent speed of sound and ultrasound attenuation. We found that bulk storage modulus is approximately 4 times the bulk loss modulus in the gelatin, indicating that bulk loss modulus is potentially superior biomarker than the bulk storage modulus. In addition, in addition to these local speed of sound and attenuation reconstruction can be used for accurate reconstruction of speed of sound. So I have more stuff to talk about from the work I did at IIT Madras and Harvard University. But I kind of thought that these two works will stimulate you to look for advanced ultrasound biomarkers, how they are useful in medical applications. So conclusion of my talk, non-linear viscoelastic parameters of phantoms and tissues are successfully measured, and then they can be used as additional biomarkers. And a novel method for reconstructing speed of sound and ultrasound attenuation is introduced. Bulk loss modulus can be used as additional biomarkers. I would like to thank the teams at IIT Madras, ETH Zurich, and Harvard University for helping me to conduct my research, and also RGKT faculty for the help during my bachelor studies. And thank you all. And if you have any questions, I'm more than happy to discuss. Right.
Any questions from the audience? Those who are in the meet, either you can type in the chat box or straight away you can turn on your mic and ask the questions to the speaker. Any kind of questions you can ask. He's your brother only now.
Yes. So not only about this talk, you can ask me if you have any questions regarding how to plan your research career after your bachelor studies, something in that perspective as well.
Yes, any questions you can ask. You can ask or you can type it in the chat box also.
Yes, Bhaskar, can you hear me?
Yes, yes.
Right. So a few of our students wants to listen from you regarding the challenges which you have faced in your initial phase of research program.
Yeah, so
I mean, whenever you have moved from UG program to MS research program, the initial challenges that you have faced, how you have overcome such difficulties, and your suggestions to your juniors.
Thank you for the question. I think many students asked me on LinkedIn. Thank you for giving me a platform to address many who has the same maybe question. So like the 2 months intensive program at ISRO Center NARL prepared me to what to expect at a research environment. Thanks to Professor Srinivasulu, it took good care of me because I'm from RGKT. He knows very well about RGKT. He is a fan of RGKT, so he took a good care. He basically every day, he took me to, he allowed me to talk with other scientists to know what they are doing. And he planned a really detailed field trips. They had a big radar to get the weather forecast if ISRO is planning to send a satellite vehicle or something like that. So after I went to IIT Madras, of course, I felt a bit, let's say, inferior for a few months. But I was able to score good grades in computer science courses with computer science undergrads. And slowly I got the confidence that, I am at par with the quality of other students, and I concentrated mainly afterwards to excel with the opportunities that I had. I could able to publish 2 journals, co-author and first author journals, and 2 conference publications during my masters, which added a lot of credentials to my CV. And after math, I tried to apply for top universities, although I know that, it might be very challenging to get into them, but I just gave it a try because I lose nothing. I just want to apply. I am confident about my credentials. So I applied to ETH Zurich, which was then, which is still top 5, top 10 university in the world. And I got an opportunity there because of the efforts I put. And after I went to ETH Zurich, for first few months, I thought same way that I felt at IIT Madras. But later I realized I have enough competence to excel. So I concentrated afterwards to conduct research, publish as many as publications possible, and gain research skills like how to conduct proper research and communication skills needed to convey your results. And after that, again, I moved to Harvard University. Here, I would say I'm pretty confident that I have enough confidence and stuff like that. So I just want to tell you have enough metal in you. You have very good skill set. You just need to believe in yourself and start learning more about. You have free time, right? You have high-speed internet thanks to Geo and others. So you can always look for information, like, for example, how the research career would be, what a researcher would do in his daily life. So you can get all this information and land up in a proper internship during your third year and get exposure to research environment. If you are happy with that, then you just need to pursue the career path. You have to write whatever the entrance test is needed for the admission into particular university and stuff like that. I think that is my long answer. Short answer is just believe in yourself and try to aim high. But trust me, you all have enough skills to get into top universities at research positions.
Are there any other questions from the audience? Those who are in the meet? Balaji. So, Bhaskar, there is a question in the chat box. Can you able to see?
Yes. Why do you choose biomedical engineering after completing your BTech in EC? So you can do biomedical engineering at all the departments. Okay, why did I choose? Mostly because of the impact it has. Let's say, like you are now, I'm now like I know on human anatomy not like a doctor, but let's say off doctor, and I can use the electrical engineering skills, signal processing, instrumentation, and algorithms for solving the clinical problems. So basically, that during the period where I got less CGPA, I spent a lot of time reading about different research careers and research areas. I was naturally attracted to biomedical engineering. If I land up with any big universities for my masters, I would have chosen biomedical engineering. Yeah, and short answer is because of the impact that you create on human lives. It might sound cinematic, but that's what my inspiration was then.
Any other questions? If there are no questions, so we will conclude this session. So firstly, I would like to take this opportunity to personally thank our inaugural speaker, Dr. Bhaskar. So I'm very thankful to him by accepting our invitation. So immediately upon the initiation of this student seminar series. And I request Bhaskar, if you are somewhere, if you come to India, you should visit the campus physically. So at any time. And that is our first request. Second request is you need to find any other speakers from MIT, Stanford. So through your close contacts, so that it will be very helpful to our students.
Yeah, definitely. So the student coordinators can CC me in the emails they approach. I can, request them in a separate channel to accept it. Even if they are not from RGUKT, I can still help you in that regard.
Sure. So I personally thank you for everything. So from starting to the end, and for delivering this wonderful lecture, and particularly for inspiring the students with your nice profile. So thanks a lot.
Thank you.
And this is the end of the session.
Thank you so much. Thank you. Have a nice evening, guys. Bye-bye.
Thank you. Bye-bye.